normally placenta जो I've already told you in gross, this is like, and this is the umbilical cord. This is the amnion, shiny, mainly amnion is there, then chorionic leaf is there, and after that maternal side is there. Okay. Maternal side में what are the parts? So basically this is your uterus. When fetus develops, morula is implanted. You have to go in the embryo. I will not teach in detail, just basic. So when morula is implanted in the uterus, then this is endometrial cavity, and this is the embryo, and this is the amnion, chorion. This is decidua basalis. Then around embryo, this the decidua capsularis, and the remaining part it is decidua parietalis. Okay. So basically placenta is, जो maternal side is decidua basalis. First and foremost, when morula is implanted, there is trophoblast layer. Here it is trophoblast layer. Trophoblast layer is there. Then it get differentiated into cytotrophoblast, okay, and syncytotrophoblast. Okay. Syncytotrophoblast, there are many cells, and it what we say, forms a syncytium. All the cells form syncytium, and it invades the maternal side. Okay, maternal vessels, it invades the maternal vessels, and many lacunae is formed slowly in between. This lacunae is formed, and here this is maternal vessel. It invades the maternal vessels, so that transfer can be easily there between maternal and fetal. Okay, so main part is cytotrophoblast and syncytotrophoblast. Okay, trophoblast gets differentiated. First is trophoblast, it gets differentiated two parts: cytotrophoblast and syncytotrophoblast. Or cytotrophoblast is mainly for the development of the fetal side, placental side, and syncytotrophoblast invades the placenta, and it is mainly responsible for the exchange of the nutrients, gaseous exchange, or all of that. Achha, what is the function of placenta? Why it is nutrients, yeah, gaseous exchange, very important. Oxygen is transferred from maternal to fetal side, and carbon dioxide is transferred from the fetus to the maternal side. Okay, gaseous exchange, nutrient, and excretory product, or and one more thing important, खाना पीना तो पहुंच गया उसके पास. Hormone, very good. Which important hormone secreted from placenta? Huh? Most important, SCG. What is tested in the urinary pregnancy test? Okay, that is the, yes, first and foremost is HCG, then progesterone and estrogen, less amount, mainly HCG for the continuation of pregnancy. All these three almost are important for continuation of pregnancy, mainly HCG and progesterone. Okay, less amount estrogen. Then what we say, there are likewise there are chorionic villi. These are the chorionic villi. Here it is syncytotrophoblast. Here it is vessels. There are many. और यहाँ पे फिर this is fetal vessels. Okay. तो यहाँ पे मिलके बनेगा हमारा umbilical cord. ठीक है. और यहाँ पे होगा maternal. यहाँ से क्रॉस करेगा तुम्हारा maternal vessels क्रॉस कर रहा है, आर्टरी वेन सब क्रॉस कर रहा है, इस बीच में एक्सचेंज हो रहा है. ठीक है. इसी के लिए लैक्यूना फॉर्मेशन इज देयर सो दैट एक्सचेंज इज इजी. तो ये फीटल साइड से हुआ. ये वाला जो साइड है मेनली तुम्हारा फीटल है, और यहाँ वाला मैटरनल है. तो इसको हम लोग कोरियोनिक लीफ भी कहते हैं. कोरियोनिक लीफ. और तुमको एक दो फोटो दिखाती हूँ. मेरे प्रोजेक्टर तो एग्जैक्टली पूरा वर्क नहीं कर रहा है यहाँ पे. ये वाला जो तुम लोग को डेसिडुआ बताया, डेसिडुआ, दिस इज basalis, this is capsularis covering the conceptus, okay, and parietal is the remaining part of the placenta. Okay, endometrium. Remaining part of the endometrium is known as decidua petis. So basically it is placenta is decidua basalis mainly. जो maternal side is decidua basalis, and all the vessels are invading in the decidua basalis only. Okay. ये हुआ तुम्हारा कोरियोनिक स्ट्रक्चर. यहाँ से आ रहा है तुम्हारा अम्बिलिकल कॉर्ड, ये एमनियन है कवरिंग, ठीक है. ये तुम्हारा हाउ मेनी आर्टरीज, 2 आर्टरीज एंड 1 वेन. ये कोरियोनिक प्लेट हुआ, यहाँ पे सिंसिशियल ट्रोफोब्लास्ट है, ये वेसल्स डिवाइड कर गए, और यहाँ मैटरनल साइड होता है, वहाँ से एक्सचेंज हो रहा है. आर्टीरियो कैपिलरी वेनस एनास्टोमोसिस बनता है, इनके बीच में एक्सचेंज होता है, ठीक है. तो किससे तुम्हारा फीटस के साइड हो जाएगा न्यूट्रिएंट्स और ऑक्सीजन. हाँ हाँ veins opposite. In fetus it is opposite. Through vein it all the nutrients oxygen जो हमारे में काम कर रहा है आर्टरी, वो काम करेगा वेन में, ठीक है. तो वेन के थ्रू जाएगा न्यूट्रिएंट्स एंड ऑक्सीजन, एंड हमारा आर्टरीज के थ्रू आएगा, वापस आएगा एक्सक्रीटरी प्रोडक्ट्स एंड कार्बन डाइऑक्साइड और एक्सक्रीटरी यूरिया सब आएगा, एक्सक्रीटरी प्रोडक्ट्स आएगा. अच्छा, वन मोर इम्पॉर्टेंट फंक्शन ऑफ प्लेसेंटा इज immunomodulatory. तो because placenta or fetus is a completely foreign body for the maternal mother. Okay, so how it survives? If you do any transplant, okay, if you have not cross match, obviously the kidney will be rejected or liver part will be rejected. So how does a fetus, completely foreign body, is residing inside the mother and developing? Because of the placenta. Placenta secretes some immunomodulatory factors like cytokines that get transferred to maternal blood and inhibit the foreign body response or immune response. Okay, that's why it is growing. Fetus is growing. Okay. One more thing is some IgG get transferred from maternal blood to fetus and provide protective antibodies for the development of the fetus and protect it from many diseases like bacteria and many viruses. But some viruses can cross placenta, like viruses. HIV or CMV, टॉक्सोप्लाज्मा, ये सब बिल्कुल क्रॉस करते हैं. बाकी भी करते हैं जो तुमने बोला, लेकिन कम अमाउंट में. टॉर्च मेनली टॉर्च कैन ट्रांसफर. ओके, मेनली टॉर्च कैन ट्रांसफर टॉक्सोप्लाज्मा. अच्छा, और ये देखो, ये जो स्ट्रक्चर में बोलছি ना, दिस इज कोरियोनिक प्लेट and this is cytotrophoblast, single cells are trophoblast, and syncytial cells are forming syncytium. Syncytial trophoblast is this one. Okay, these are forming merging and forming in lacuna form of thing, and this is the maternal side, decidua basalis. Maternal vessel is passing through it, and nutrients exchange is taking in between this layer. Okay, this is the main anatomy of that. Many abnormalities can be there in the placenta. Do you know any abnormalities?
After placenta acquainted spectrum.
वो तो बिल्कुल हाई-फाई हो गया. नॉर्मल बताओ. Anatomical variation. हाँ, anatomical variation. Simple anatomical variation. हाँ. One is your placenta lobe, सुना, subcingulate lobe. Subcingulate lobe means कि one small lobe is developed apart from the normal placenta. One small lobe is developed and it is placed other than the normal placenta and connected through vessels. And vessels are not protected by whole chorionic leaf. This is just covered with membrane or even sometimes not even membrane, and this is connection is there through vessels, and this lobe is there, and this is the most common cause of PPH in abnormal placenta, because many times whole placenta has been delivered but this remains inside this. The subcentrate lobe is very common, many times we have seen it. One is battledore. Battledore placenta. What is battledore placenta? The marginal implantation of the umbilical cord. My umbilical cord is placed at the margin of the placenta. Okay, not center. Normal with the center में होता है. ठीक है. Normally यहाँ पे center में रहता है umbilical cord. But in battledore it is at the margin. Marginal insertion भी बोलते हैं इसको. Marginal insertion or battledore. One more, but what I was telling you earlier, circumvallate. Circumvallate means कि the chorionic leaf or amnion is not covering whole of the placenta. So a disc form of thing is formed at the margins. This is whole covered and chorionic leaf ends over here. Yeah? The remaining part is not covered with chorionic leaf. It is exposed. Okay? So this is circumvallate. Circumvallate. This is battledore. Or one more is, have you heard of Vasa Previa?
Vasa Previa.
This is a form of battledore, velamentous insertion of the placenta. What is velamentous insertion? This umbilical cord is inserted. One is your velamentous insertion. That means ki your placenta is inserted in the membrane, not the actual placenta. The amnion or membrane is there. The placenta is inserted in the membrane. You can see the vessels passing through the membrane. Okay, vessels are not properly protected. If any injury is there, any rupture is there, the vessel will rupture and cause severe bleeding or abruption or any antepartum hemorrhage. So this is a very common cause of antepartum hemorrhage, Vasa Previa. When the vessels not protected by the placenta is covering the os, like your uterus, cervical os is there. Many times here vessels are passing. Okay, this is Vasa Previa, and if any cause such as this cervix, it will call rupture of the vessels, and it's called bleeding. Okay, so I will show you some photographs. ये हुआ velamentous vessels exposed है, ठीक है, बस एमनियो से covered है. This is highly problematic for the baby especially, because fetal blood is lost mainly in this case. Okay, so if any injury occurs, it will straight away lead to abruption or APH. This is circumvallate. The margin is not covered with the chorionic leaf. Okay, this is bilobed placenta. It is not that common, and this is subcentrate lobe. This part is subcentrate lobe. The vessels are exposed in this case, and this is battledore, marginal insertion of the placenta. Umbilical cord. It is inserted at the margin. Okay. ये वाला जो है तुम्हारा clear cut सुंदर सा पिक्चर है. This is your decidual basalis. Okay, this is your embryo, this is your decidual capsularis, and this is parietalis. Okay, and this is uterine cavity. So later on it dissolves and amnion is just there, and it decidual basalis, whole placenta is developed over the decidual basalis mainly. ठीक है, बाकी पार्ट इतने इम्पोर्टेंट नहीं रहते हैं बाद में जब डेवलपमेंट हो जाता है. अच्छा, ये अस पर आता है. तुम लोग जो बोल रहे थे क्या एबनॉर्मलिटी बोल रहे थे? ठीक है, प्लेसेंटा एक्रीटा, और क्या होता है? हाँ, स्पेक्ट्रम. क्या क्या होता है उसमें स्पेक्ट्रम में? एक्रीटा, इनक्रीटा, परक्रीटा. ठीक है, एक्रीटा में जस्ट तुम्हारा अडेशन हुआ है. ठीक है, इनक्रीटा में इन्वेट किया है, परक्रीटा में पूरा क्रॉस कर लिया, मतलब ब्लैडर की तरफ चला गया. ठीक है, तो कैसे याद रखोगे? ए पहले आता है अल्फाबेटिकली, आई बाद में आता है, उसके बाद पी आता है. एक्रीटा इज एडिशन, इनक्रीटा इन्वेजन, परक्रीटा परफोरेशन. इस तरह से याद रखते हैं. ठीक है, तो ये हुआ तुम्हारा प्लेसेंटा एक्रीटा स्पेक्ट्रम। और प्लेसेंटा प्रीविया बोला था, प्रीविया क्या होता है? व्हाट इज प्लेसेंटा प्रीविया? प्लेसेंटा प्रीविया
नीचे आ जाता है, यूट्रस के एंड पे आ जाता है। सर्विकल ओपनिंग
ये हुआ एक्रीटा, ये हुआ इनक्रीटा और ये हुआ परक्रीटा। ठीक है, पूरा क्रॉस कर यूट्रस। हाँ, व्हाट इज प्लेसेंटा?
पोजीशन ऑफ द प्लेसेंटा
Less than 2 centimeter from the cervical os. Okay, cervical os. Okay. And what are the types of placenta previa?
4 types.
marginal,
Type 1 2 3 तो पढ़ोगे ना?
टाइप 1 2 3 4 मैम 4 में पूरा बीच में आ जाता है पोस्ट के, मार्जिनल में उसके थोड़ा ऊपर रहता है।
One is the low line placenta, एक होता है placenta previa. Type 4 को बोलते हैं placenta previa.
पार्शियल
New classification is low line placenta and placenta previa. Placenta previa is type 4 and type 1 to 3 are low line placenta, and which touch the internal os of the cervix, that is placenta previa. If it did not touch, then it is low line placenta.
लो लाइन। तो टाइप 1 और टाइप 2 में ए भी पता है? टाइप 2 के ए और बी होते हैं, एंटीरियर पोस्टीरियर के हिसाब से होता है। टाइप 3 में जस्ट पार्शियल कवर कर रहे हैं os को, ठीक है। टाइप 4 में पूरा कवर कर रहे हैं, इवन इन डायलिटेशन वो कवर कर रहे हैं, ठीक है। और जो पार्शियल होता है, मेनी टाइम्स ड्यूरिंग डायलिटेशन इट सबसाइड्स और गोज रिसाइड्स बैक in partial during dilatation, but in type 4 during dilatation also it will covering the os. Okay, so type A, 2A is dangerous or B is dangerous? B is dangerous. Why? Posterior pressure is more and it will lead to less supply to the fetus. Okay. ये हो गए तुम्हारे। हाँ, और क्या होता है एक टाइप? Abruption placenta. What is abruption placenta? Bleeding inside placenta.
Placenta separated from the premature separation of placenta from the uterus.
कितने टाइप्स के होते हैं?
दो टाइप
Revealed. तो which one is dangerous?
Cancer is
Cancer
dangerous.
is very good. Cancer is dangerous. What are the sign and symptoms of placenta previa and abruption? Abruption को बताओ।
In case of abruption placenta, bleeding, one episode of bleeding, and pain will be there, abdominal pain, and the difference with this placenta previa is placenta pain will not be there in placenta previa.
तो एग्जाम में था ना क्वेश्चन, बहुत सारे एग्जाम में तो क्वेश्चन थे, एमसीक्यू में थे। क्या पेन है? Pain.
One episode of
Bleeding. One or many episodes continuous bleeding can be there. Or some one important history में क्या पूछोगे? सबसे important चीज hypertension, very important. Hypertension होगा।
Color of the blood is dark because color of the blood is dark because the bleeding is
color के हाँ, placenta previa there will be fresh blood, but we don't go on the color of the। सबसे important thing is pain and your bleeding will be maybe fresh, maybe concealed. Okay, it can be revealed or concealed. We don't go over the color of the blood. You will go for the history, very important. Patient will have pain and a history of PIH. Many times patient will have severe pain, and how you will see on examination, what you will see on examination. Patient comes at 28 weeks pregnancy and she is complaining of pain and bleeding. What you will look for? She is having hypertension, pallor,
and then we have to ask for history. There is history of hypertension. Then
there is history of hypertension.
if there is history of hypertension, then if we have to check the BP, and the BP, even if the BP is normal, but still we have to because if the blood pressure was high before, then after bleeding the blood pressure will be normal. So
History is very important. And then examination में क्या देखोगे? pallor, the general examination, the abdominal
Is
examination,
open or not?
general abdominal examination,
Oh,
per abdomen examination,
Fundus
height
very
of the fundus, very important. You will mark the height of the fundus, and later on examination you will compare the height. If it has increased, that means bleeding is occurring inside the uterus. And then many times the uterus may be tonically hard. Okay, you will see if there is tonically hard FHS, many times there will be bradycardia or IFD may be there in abruptio. You will examine. Per abdomen examination is very important. PV we usually don't do if antenatal patient is complaining of bleeding. We don't do PV unless until there is no OT vacant. So if you have to examine, you will do only per speculum examination, only nothing, no PV, nothing, no examination. PV is not done. And antenatal patient, if patient has come to you in emergency with bleeding PV at 28, 32 or term gestation, you will not do PV in emergency. You will call the senior, or if you are in gynae, then you will wait for the OT. If OT is, you will do PV examination in the OT setup only. If there is full preparation of emergency cesarean section in case any bleeding occurs, okay. Or if any OT is not vacant, then you will do just per speculum examination. Just see the condition of the cervix or os or the placenta. You will not do PV because many times bleeding is there, so much amount of bleeding APH is there कि patient may go into shock, and by the time you will shift the OT, baby may die and patient may get deteriorated. Okay, तो ये हुआ तुम्हारा abruption. ठीक है, एब्रप्शन का तुम ऑलरेडी क्लास सब हो चुका है. प्लेसेंटा प्रीविया भी हो गया है सब, है ना. और प्लेसेंटा प्रीविया में व्हाट विल बी द हिस्ट्री इन एग्जामिनेशन.
Maybe episodes of
A patient will come at suppose 32 weeks में patient has come, and patient is complaining of bleeding PV. What you will see?
pain is there or not.
Pain is there or not, we will see, check the vitals, BP, okay, pulse, BP, any pallor, how much pallor is there, any tachycardia is there or not. You will examine per abdomen, you will see for fetal heart sound, and you will take the history of any previous episode of bleeding is there. Many times in placenta previa there is many episodes of bleeding. Patient will say कि एक मास आगे एकटू bleeding होइछिलो आमार. Or you will check the investigations, any previous report of any placenta previa, low lying placenta is there, you will get alert. This is a most probably case of placenta previa. Or one more history is important in placenta previa. Which history? Previous LSCS. Okay, very very important, because if patient is having placenta previa and patient was post CS patient, then there is high chance of placenta accreta spectrum. Okay. Mostly, you will say 70 to 80% cases of placenta previa with post CS patient is there is high chance it will be adherent. That is, there is no other chance that placenta previa is there, because in 80% of cases, you know, if a patient is pregnant, 20 weeks pregnant, comes to you with USG report of low-lying placenta, 80% patient will placenta migration will be there, or in some cases it is not there. Mostly cases are these post-CS patient. Placenta doesn't migrate mostly in most of the cases. So in this post-CS history or previous LSCS history or any previous myomectomy, this any scar on uterus, scarred uterus history is there, that means it can be adherent placenta spectrum.